you heard, I'm Karen Walker. As you know, I'm Program Administrator for ESIT, and I would like to thank you for participating in today's webinar on completing the local team self-monitoring tool and process. But before we get started, I'd like to have the ESIT staff presenting today just briefly introduce themselves.
I'm Sheila Ammons, Program Consultant with ESIT.
Kathy Grant Davis, Program Consultant with ESIT.
Kathy Blodgett, Program Consultant with ESIT.
And as Bob mentioned, we have a way to see who's participating on this webinar. So as is our custom, we usually like to have folks introduce themselves. We won't be doing that right now because there are too many of us, but we can see who is participating. So anyone who's interested in knowing, I think you can see who's on the call, or excuse me, on the webinar with us today. So that will serve as our introduction to each other. The purpose of the webinar today is to introduce you to in a more structured way the self-monitoring tool and process that we've talked briefly about during past meetings. So we hope that you will take the opportunity to submit questions or to share your ideas. We look forward to be able to provide you with further clarification as we learn together through this new process. So with that, I'd like to turn the webinar over to Sheila.
Thanks. As Bob mentioned, the webinar is being recorded and will be available on the ESIT website. We're planning to pause at the end of each of our 3 sections to give an opportunity for you to ask questions. Our preference would be if you typed your questions into the chat box. That gives us a great record, so any questions we're not able to get to today, that's helpful for us as we follow up with you. So what we'll cover, 3 main components of today's webinar. First, I'll start with an overview of the General Supervision and Monitoring System. Then Kathy Blodgett will talk about the local process and the local team. And we'll end with Kathy Grant Davis talking about the 6 questions on the self-monitoring tool in more depth. We also have our upcoming monthly LLA calls and our May LLA meeting, so we have opportunities for further discussion in the future. Again, just at an overview, we have talked in the past about the 3 main components of the General Supervision System. The data management, we're all familiar with the DMS. And the good news is there's no change in the process related to entering information into the DMS. Nothing at all about that piece is changing. Second, we've talked a little bit about the annual self-monitoring tool, and that will involve all LLAs completing the self-monitoring tool each year. So that's a bit of a new piece. And for on-site monitoring, each LLA will receive a visit at least once in the 5-year cycle from ESIT. If there are concerns about compliance, performance, or risk factors, such as the size of the program, an LLA could receive an on-site monitoring visit more than once during the 5-year cycle. For our large counties, you may receive more than one visit during the 5-year cycle simply because of the large number of children served, the amount of the contract, and other risk factors. The purpose of the self-monitoring tool is to really help local teams reflect on their current practices. And this really helps to drive a continuous improvement process at the local level. The self-monitoring tool will be used for training and technical assistance. So the information that is sent to ESIT from the self-monitoring tool, we're planning to use that for training and technical assistance. And it will also help you at the local level see the areas that would be right for training and technical assistance. Looking at the annual timeline for each component of the system. The DMS, this year we're looking at January through March data, and that includes all records in the DMS. And again, we're not planning any changes to that piece of the system. For the self-monitoring tool, we're looking at each fall that LLAs will review a sample of the child's records, and those will be randomly selected by ESIT. And for the on-site monitoring piece, every quarter ESIT will conduct an on-site visit, and at a minimum, that'll be at least once every 5 years, regardless of risk factors. This shows some of the overlap in the annual activities. If longstanding, uncorrected noncompliance is identified, it may impact the annual determination. When LLAs identify infrequent or isolated instances of noncompliance, a corrective action plan won't be required. We expect that as each LLA goes through this tool, they will probably come up with something here or there that they'll rate as a no. But on our end, that doesn't necessarily mean a corrective action plan. If it appears to be systematic noncompliance, then we're required to develop a corrective action plan. So there's some data analysis on our end once we get the information back. And from that, we'll determine if a corrective action plan is needed. So this is our first break in the content, and so we just wanted to take a pause and see at this point if you have questions. I know we're not very far into the webinar yet, but if you have questions about anything in the overview that we've talked about, it probably sounds pretty familiar to you. We have been talking about this for a while. So if there's not questions yet, that's okay too. We could save some of our time for more questions later. So I'll give you a minute just to see if there's any questions now.
So two ways again is you can type your questions in, or if you raise your hand on the little control, then I can unmute you and let you ask your question.
Maybe we'll keep going.
Okay, thanks, Sheila. It's Kathy Blodgett, and I'm going to review the second part of our webinar, the local team self-monitoring tool process. Really, the purpose of this process is really to show us how your current process and procedures are working at the local level, at your local level. It really provides you a tool to identify your own needs based on the results of your process, to identify training and technical assistance that you may need from us. And it's also used to promote the use of high-quality evidence-based practices. So it's really a reflection of how things are organized in your local system and how it can be improved if need be. Which records will be used to complete the tool is the next slide. We're planning on using July, August, September 2013 records, so next July, August, and September, to complete the self-monitoring tool. Since you will have your September data in the DMS by the 10th of October for your contract, we're looking at mid-October. We will identify records to be reviewed, and our plan is to email you the child identification numbers. So your children in your local system, we will email you child ID numbers. Then the process would be for the local aid agencies to complete the tool anytime mid to late October through mid-December. So that gives you a 2-month window. We will provide the list, as I said before, of the records. You'll complete the self-monitoring tool process for each child record reviewed mid to late October to mid-December. And then one team member that you will decide who that is compiles the results of each record reviewed and records ratings on a summary sheet that you will submit to ESIP. Only the summary sheet is going to be submitted to ESIP. All of your individual child records will stay with you at the lead agency. Those individual ratings are kept at your local lead agency if need be for future on-site monitoring visits. We may ask to see those results. What are we going to do with the data that is submitted? We are going to analyze it, as Sheila has already said. We're going to review it to see if we have to have any training and technical assistance developed and provided to you. So based on the review, we're going to provide technical assistance, training, and guidance back out to the field. There's a lot of words on this slide, but did want to share with you how many files will be reviewed. We've had questions about that when we presented this information at last November's local lead agency meeting. So to ensure representative data, your numbers of files to be reviewed will really depend on your own local LLA structure, the number of early intervention programs that you have within your local structure, and then the staff who are developing the records. Because to be representative, we want to attach all local lead agencies, all EI programs, a variety of staff that are developing and maintaining the records. The records that we're going to be selecting will be based on the December 1, 2012 count. For local lead agencies with 1 to 48 children, we're going to select at least 3 child records for each local lead agency or EI program. And if there's one local lead agency and one EI program, we're going to select records from both. And we may have 2 records from one and 1 from the other to make it a total of 3 records. 3 records will be reviewed, 1 to 48 children. If your December 1, 2012 count was 49 to 100 children, at least 3 child records for each serving EI program within the service area we will be selecting. For 100 to 1,000 children, 5% of records will be selected, including at least 3 records from each program. Some of the larger counties have a range of 2, 3, 4, 5, up to 16 programs within them. And then again, at 1,000 plus children, at least 3 child records for each serving EI program within the geographic service area. The key message is that we will be getting data for each program within your local system to ensure that we are looking at representative data. And we will use random selection according to this criteria to identify the child records. The composition of the local team. It's the local lead agency that will decide who will be part of the local team. We want this to be a meaningful process for teams to look at IFSPs. So it would be your decision on who will participate on the team, how many members will be included on the team. We are requiring a team is more than 1 person, so there has to be a minimum of 2 to make up a team. And for larger counties, would they need more than 1 team? So you would decide how many teams are needed. We've outlined maybe possible team structures. At least 2 of the following. As you can see, an FRC and a provider is bolded as probably the first 2 that we would really expect to see as a team. Because completing the tool is most helpful to your providers. We think the team would be incomplete without a provider and an FRC, because the questions on the monitoring tool reflect work done by the providers and the FRCs. This isn't just another exercise for FRCs to do themselves. It really is a structure of the service providers themselves and the FRCs and whoever makes the most appropriate sense to look at the records. You could have one team for each program, a single team for an NDC, or one team for a portion of the county. So we are not having any criteria around how your team is formed. That really is your local decision. The total number of records to be reviewed are split between the reviewers of the team. We don't want this to be a duplicative process. The team is trained by the local lead agency on the common methodology that you will use to start and finish this process. And then for local lead agencies in the larger counties with perhaps multiple teams, the child record selected will include those children from the areas represented on the review team. So we want the review team to be looking at their own child records. The team will decide how many records are reviewed by each team member. For example, if an LLA reviews 9 records and the review team has 3 members, then each reviewer could be assigned 3 records to review. Or if the team has 2 members, one could review 4, one could review 5. We will be sending you that list, that disaggregated list of the child identification numbers, and you can decide locally how your teams will form. Key questions for the local process. So these are just things that you would want to think about and explore as you form a team. How will the providers and FRCs be included? How many records will each team review? Or do you have enough people? Well, when will you meet to start the review process and define your own local process? How often will you need to meet? Do you review records at the same time and in the same place? Who will be responsible for compiling the results? These are just basic questions that we came up with. You may come up with more. A suggestion is to, if you have annual staff planning or have a annual staff retreat, that this could be something that you could have discussion about as you consider how you're going to form your team. Things to think about for future planning. Again, as Karen said, this really is a process where we're hoping that the results are, you will look at the results to improve, or if you need improvement to your own program and process. What would your plan be to evaluate the improvement results? If you found something that really needed to be improved and you took action to improve it, how would you know that the steps that you took were successful? And you could look at how to integrate the review process into your agency's or organization's strategic planning process, if you have that kind of a process in your own local agency. So we're just encouraging local lead agencies to think about this now and to start to make decisions about their local process and how to form their local self-monitoring team.
We know that some of you might be wondering about consistency in ratings between individual raters on your team. Inter-rater reliability is a statistical concept and measure used to ensure that the group will have comparable results from each rater on the local team. And depending on how your team is organized, you may be interested in having a discussion about this with your team. If your team is interested, here are 2 examples of methods that could be used by teams to look at inter-rater reliability. We do recognize that there are complex and detailed protocols used in research to establish inter-rater reliability, but we also understand that local teams have already committed significant time and staff resources to complete the self-monitoring tool. We know that our results won't be scientific, and that's really okay. That's not what we're going for. ESIT is not requiring teams to adopt an inter-rater reliability procedure, but we recognize that some of you will be looking for ways to ensure consistency across raters. So this isn't a requirement from ESIT. However, if it's something you would like to do, you're certainly welcome to do that. So the first example of a test record is really, like Karen put it, it's a dry run. It's looking at a sample file and having multiple folks complete the same review and then looking at your results. A group rating, the raters could review some or all of the records in the same room at the same time. And everybody could look at the first question and then pause for discussion and talk about things that you found and have that discussion literally as you're doing it. So those are just two examples. And so again, it's not required by ESIT, but if it's something you'd like to do, you're welcome to do that. We're going to stop again for questions. I see in the chat box we do have some questions listed. Maybe I'll go ahead and read them out loud. The first question, when will the LLAs receive their list?
And as I shared, it would be after mid-October when the September data should be in the system by October 10th. And after that point, we will be going for the selection, and then we will email the child identification numbers to each lead agency. So we're hoping the third week in October, third, fourth, depending on, this is the first time we're doing this, so that's our plan. Right after mid-October.
The next question, is there going to be a protocol shared for the on-site LLA monitoring visits? I would say it a little differently. We're doing our first two on-site visits this year, and the first activity we have planned with those counties is a conference call. So we're planning to inform you each step of the way about what are the plans and what will it look like, what do I need to have ready, what do I need to tell staff. We will communicate that to you. At this point, I'm not sure I would call that a protocol, but certainly discussion about. We are also working on a monitoring manual, so there will be a resource document that will help to give more information about that. Third question, just for clarification, every LLA this year will need to do the local teams tool, and only select LLAs will have the on-site. With on-site scheduled for May, do we need to do our part of the tool prior to the visit? And the answer is yes. Connie Zapp asked this question, and she is one of the counties that has been selected. Kitsap County and also Okanagan are the two counties that will be visiting this May. And so for Linnell and Connie, yes, you would want to have that completed before we come on site.
And for clarification on the first part of your question, Connie, the local lead agencies will use this process next fall, beginning with the contract starting July 1st. So it won't be this contract year ending June 30th. All local lead agencies will complete the tool process next contract year beginning July 1st.
All right. Next question. In our county, servicing EI program has more than one location. Would like to see child pulled from each location.
That's very good, Renee, and we will use that information as we do our random selection of child records.
Next question. What are the dates the files will be selected from?
And the dates the files will be selected from are your records that you have developed from July, August, and September, kids that are active IFSP kids in the system as of July, August, September 2013.
Next question. So we will need to do it again in October from Connie. Yes. Other questions?
Maybe just to clarify about that, Connie, as well, we recognize that the two counties who are helping us with this process, we are asking you to just do an abbreviated version of the self-monitoring tool so we can learn from you about that process. But the intention is that programs will use the entire tool to do this kind of program review to begin to focus their training, their own local training and technical assistance. The goal is that this is really going to not be a laborious exercise, but that it's really going to be helpful. So, but again, we intend to learn from and appreciate those two contractors who you, Connie, and Linnell have volunteered to really help us figure out this new work.
Okay, another opportunity. If anyone wants to speak, you can raise your hand and I'll unmute you, or you can type in questions too as we go. So either way is open for you guys. Okay, there's one more question here.
Okay, from Whatcom County, is there a ballpark figure in regard to time it will take per file? That's a great question. We're not sure at this point. Some of the information that we got from the pilot sites, I don't know, Kath, if you would want to talk a little bit about that.
You know, we do have two sources of finding this information, which we'll talk a little bit more detail about shortly. We have, of course, our electronic record in the DMS, and we also have some documents in file, hard copy. So yeah, as you set up your local process, think about which will be the optimal place to look for the answers to these questions. And I believe that they looked pretty much at hard copy in the pilots, and it also depends on the size of the file, which some of the feedback we got said some files was harder to find the information than others. I think the first file that you look at is going to take a while to find out where the information is located in that particular file for that particular agency, and then the other ones will be a shorter period of time. It would be tough to take a guess because you were all organized so differently how long each file would take.
And we've also made some changes to the tool.
So you're not answering as many questions as the pilot sites answered the entire tool.
Yes.
Right.
So I think your first file is going to take you, depending on the size of the file and how it's organized, 20 minutes to 45 minutes or something, especially if you have discussion. I would imagine that as you get the hang of it, the other two files that you do for your total of 3 would be much quicker, 10 minutes, 20 minutes. Great.
Okay, I don't see any other questions unless there's someone's typing right now. No one's raising their hand. Okay, shall we continue on?
We'll continue and we'll give you another chance to ask questions before we end. Our next section is really looking at the 6 questions that you will be answering on the self-monitoring tool. Now these are the questions that you're going to be looking at in the fall, that everybody will be looking at. But as Karen said, we encourage you to look at the entire tool if you want to, and think about any issues or improvement areas that you may have associated with the other questions on the tool that are currently grayed out. So we're just going to go through the 6 questions that we want you to attend to this fall. So question 1, is there evidence that the parent was provided the parent rights document? And you all know that now we have a booklet, and we also have paper form of that booklet that's condensed the information. And an explanation of the rights was provided initially and when prior written notice and or consent is provided. So there are several times as you read through your parent rights TA guide that you are giving the parent rights document. So you will see that this is a multiple answer question. One of those that has multiple parts because you are going to be looking in the file for every time the parent rights document is given and a note of some sort that an explanation was provided at the appropriate time. So you could probably see that, and this is for all the questions. Please read the guidance that is in the tool before each question, because it's going to tell you why you're looking for this, what you're looking for, and what might constitute evidence of yes or no if you don't find it. So I think that the tool helps you decide, is it a yes or no question. You're looking for these multiple questions for the yes or no answer multiple times, and there's a place for notes on that decision that you make, yes or no. So you may find this as a note in the data management system. You may find this if you have a checklist for your process for your parent rights. You may find it as a note in the hard copy file. So there are a couple of places you want to look for this. And that might be true for all the questions. So this one's probably the longest that has the most yes or no choices. Question 3, did the family identify its resources, priorities, and concerns related to enhancing their child's development and provide information about everyday routines and activities through the family-directed assessment? This is a yes or no question, and you can see it in your data management system record, and you may also be able to see it in the paper document. This is the family statement, the family directed assessment, which is voluntary by the family, as you know. So the no answer here is not necessarily bad if you have documentation that the family did not wish to provide. So you're looking basically, did they give you any information about their concerns, priorities, resources, and routines? So the no is not necessarily bad because you're also going to be looking at question 4. If the family did not identify resources, priorities, concerns, is there documentation in a note, electronic or paper note, that the family declined? So that's a fairly simple yes or no question once you find where it's recorded. Now here's another multiple, question 5. Did the evaluation and assessment for eligibility, okay, so your initial evaluation and assessment, did you identify present levels of development and unique needs of the child in each developmental domain? So that's a lot of words to really refer to your present levels of development section in your electronic record. That's the PLOD page, present levels of development. So you are going to be looking on that page to see if something was recorded for each domain, and you're going to be looking for level of development and that narrative that describes unique needs. That one is a multiple because you're looking at a yes, no for each domain. Question 6, does the IFSP statement, is there an IFSP statement of the child's current developmental status that does include or contain functional skills, including strengths and needs relevant to challenges and what is working well in everyday routines and activities? I understand that some people are really talking about functional skills on the present levels of development page, where we really want you to be talking about functional skills and what is working well in everyday routines and activities is on the summary of functional performance page. So you may be seeing this kind of functional statement or a statement about the child's functional skills on either one of those pages. And you are going to want to sort of use the definition there, you know, is there a functional statement of what is working well in everyday routines to help you answer your yes or no. Again, read the guidance and what evidence of yes would look like on the tool. And last but not least, you're going to have question 12. Does the child's IFSP indicate that all the IFSP services are provided in natural environments? And that's a pretty straightforward yes or no, but another question where the no doesn't necessarily mean there's anything wrong. Because, yes, there may be cases where the child's not getting services in natural environments, and you've written a perfectly fine justification statement. We do not have a question on the tool or on this part of the tool. You will see that question 13 is grayed out, and that's the one that addresses justification statements. So this is a fairly simple yes or no. Are the services all provided in natural environments or not? And you can make notes there and take a look at the justification statements, but that's going to be future TA and technical assistance. Those are the 6 questions that we chose to focus on for this fall's process. 4 of them are the simple yes or no when you find the documentation, and 2 of them were the multiples. So that's the multiple times that you would talk with families about their procedural safeguards and was the parent rights document given. And then you're going to be looking at all the present levels of development for that multiple. Okay.
In terms of next steps,
should we go back just a second?
Absolutely.
There's a question about number 6 while we're on this.
Maybe I'll just read the question. This is the only one where, when we reviewed, we thought there should be a middle ground type of choice, maybe somewhat, that there is something there, but not be full. Also, what is the quality on the bottom point, the need to be able to rate?
Connie, can I unmute you and you can ask here?
I think we need a little more detail.
Let's see if I can unmute you. There you go. Go ahead, Connie. We should be able to hear you now. Go ahead.
Maybe she's muted. Did you mute yourself?
Can't hear you, Connie, but keep trying. Oh, guess
Can't hear you. Well, my one thought, Connie, and if we don't answer this completely, we can certainly answer after the call and before we come out to see you. But I think, yes, this question of all of them probably is going to involve a little bit of judgment. Is the statement that is there in the present levels of development or on the summary of functional performance page, does it really address functional skills and what is working in the child's everyday environment? So there's a little bit of interpretation associated with this. I think you could, do your best, and obviously you're not looking for is something there or not there. You're looking for is it a functional statement or not. So in all cases you'll see a statement, and you need to make a little bit of a judgment about is it really speaking to functional skills. And that's why we have the notes page. So if you find something in a maybe or not sure or gray area, you could definitely note that.
And Connie added that.
Another question from Wendy. On the summary sheets, would you consider spelling out the ABC items, one word, for question 1 and 5? I think it would reduce possible recording errors if you did. I understand what you're saying, Wendy. Give just a little prompt in addition, and I think we could easily do that.
Thanks. Great idea.
Keep thinking of questions, and I'll move on to next steps. As I mentioned, we have identified the 2 programs that have been selected for this year's phase-in of the self-monitoring tool and on-site visit, and those are Kitsap and Okanagan counties. So they will be the 2 counties participating for the current contract year. For everybody else, LLAs will receive the tool electronically with their annual contract. So it will be coming when you receive the contract. What you'll want to do, even starting now, is identify the local LLA team or teams. Have that conversation, give it some thought, come together and have some discussion about it. Meet with the team to answer the key questions that Kathy Blodgett went over. And all LLAs will complete the self-monitoring tool in the next contract year in fall of 2013. Okay. We'll pause again to see if there are any additional questions. And you can certainly ask us questions after the webinar. Anything else that you're wondering about now?
Next one.
All right. In summary, we looked at an overview of the 3 elements of ESIT's general supervision system, the DMS, the annual self-monitoring tool, and on-site monitoring. We examined the process involved in completing the self-monitoring tool, including the local review team and key questions that need to be addressed by the LLA. Finally, we also took an in-depth look at the 6 questions, which will be answered by each reviewer on the local team. As I mentioned, you're welcome to contact your program consultant with any questions. We'd like to thank you for your participation in today's webinar. We are done just a bit early. We'll be posting the webinar on the website, on the ESIT website, as a resource for you in the future. Thank you very much for attending today.
Okay. Any final questions? This is Kai.
So please don't hesitate to send additional questions. We will be responding to all the questions that have been posted, even though we've had a bit of a discussion. a preliminary discussion on the questions that were posed today and really even considering the comments. So please continue to provide that feedback as we move forward and continue to find ways to improve our practices. Well, thank you for being on the webinar with us today. We appreciate your time and we value your commitment to serving all of the children in our state who really benefit from your expertise and support. Thank you again.
Goodbye.